It's a liquid biopsy. And it's going to tell you which medications, chemo included, and other immunotherapy are most sensitive for your cancer cells, repurposed medications as well. It'll also tell you which herbs or nutrients will assist on stopping the replication of these circulating tumor cells. And that is going to help your body either fight the cancer completely or delay the cancer's ability to replicate and metastasize. So it's basically giving your practitioner and you the tools on what your protocols can be. Use this technology to your advantage.
You've just heard from Dr. Agolli, an integrative practitioner with nearly 3 decades of experience and the founder of Progressive Medical Center in Atlanta. He works with cancer patients using specialized testing, nutrition, and integrative therapies alongside conventional care. In this episode, he explains why scans aren't enough, how tests like ctDNA and RGCC can detect cancer earlier, and what it takes to be proactive about recovery.
Hi, Dr. Agolli. Thank you for joining us today on Hill Navigators podcast.
Well, it's great to be here. I'm very excited to educate on some exciting advancements on integrative oncology.
This podcast is going to be very fruitful for those that are tuning in today. And Dr. Agolli, can you share a little about your background and how you came into integrative and precision oncology?
Yeah, I'm an integrative practitioner. I've been practicing functional integrative medicine for over 27 years. My original background, I had a PhD in nutrition. I became a naturopath and went to medical school. My interest in cancer has always been personal in nature because I had family members that got cancer, my father in particular, and I'm not against allopathic oncology, but I do believe at that particular time I didn't have the knowledge and I wasn't able to assist my father, and he lost his battle to cancer very quickly with non-Hodgkin's lymphoma. And the only thing that was offered to my dad at that particular time was conventional therapies. He never talked about lifestyle, never talked about diet, never talked about root causes on contributing factors. It was pretty much a protocol. And, unfortunately, there have been some advancements, and that was well over 35 years ago. There have been advances, but still, we're seeing a lot of oncologists today practicing protocol medicine, which I believe is a mistake for those individuals that are battling cancer because there's so much research now to do other things, and that does involve root cause. And that's why you have to think outside the box.
I totally agree. Things that we need to uncover to get someone back into an optimal state of health and wellness. Over the years, you've worked with many cancer patients. When you think about their journey, what's one challenge that consistently you see them face when it comes to monitoring or their follow-up care?
I believe that traditional oncologists are very good at diagnosing. I think that they do a really good job from a testing perspective. However, there have been some great advancements, and I think some of the challenges for cancer patients are: is the treatment working? What are the chances of recurrence? A lot of times when a patient's done their round of chemotherapy, they're basically saying, I'm cancer-free. So they think they're home-free, yet, as we know, cancer has a way of rearing its head back in a period of time. So I think that monitoring is very important. I think there's some really interesting tests out there with circulating tumor cells and also looking at DNA fragments. That's going to help the oncologist or integrative practitioner to monitor before or in between scans. So that's pretty exciting. And that's relatively new in the career field, last decade or so, but I think it's become more prevalent now. So I think monitoring the cancer is always a challenge.
I agree. Most patients, they're familiar with the wait and scan model, right? You get a PET scan or CT scan, maybe some basic labs, and then you're told whether something's growing or not. But your approach, or the integrative oncology approach, looks beyond that with, as you mentioned, looking at the fragments or the ctDNA. Can you kind of dive in about what's not being offered or tracked in the conventional or standard of care testing?
Yeah, I do believe that scans play a huge part on monitoring, but sometimes the tumors are not picked up for months, sometimes even a year plus. So these tests, it's a liquid biopsy. So basically it's a blood test, and that's going to have the ability to determine if there's any DNA fragments of that tumor in the bloodstream, either from a die-off or it's beginning a new cycle, which we call neoplasia. And these cells are replicating and they're constantly going into something called mitosis, which they're growing, depending on which cycle they're in. And obviously your immune system plays a huge role in monitoring this as well. But this helps your practitioner to determine, do I start treatment? Do I push up the scan sooner than 6 months? You know, one of the concerns with scans, of course, are the amount of radiation. And I know that's a concern as well, not for MRIs, but for CT scans, of course. And there's a time to use those appropriately. But it is a blood test. It's a liquid biopsy. And, you know, one's measuring the DNA fragment, which is looking how the cancer fragments are multiplying or their lack of, and the other one's circulating tumor cells, which are actually in the bloodstream. So it can help also determine if you are developing cancer, or while you're in remission, is it growing? Instead of just the wait and see mode, because we're seeing a lot of patients come back in a year or 2 years later after going in remission that their cancer has come back. And for the average layperson, Peyton, that's a very scary thing, right? They've been through this traumatic cancer, the big C, which is frightening. Let's be honest, there's nothing easy about cancer, and it disrupts your life. And that's one of those things you have to deal with from not only a physical perspective, but emotional and spiritual. And now that you are sitting there waiting, that causes a lot of trepidation, anxiety, and fear. So I believe that these tests, as they continue to be more accurate, nothing's 100%, but I do believe the sensitivity is relatively high, well over 95 to 98%. And this is an exciting time for diagnostics in cancer. If someone is out there listening, they've not heard about this, there's some great tests out there.
Yeah, sometimes a patient will hear your skin is clear and they get this huge sense of relief that their cancer is gone, right? You can't see it on the scan. It's not physically there, but you still have those microscopic cells floating throughout the body, in which these tests can measure and determine that. Can you explain how these testings will be beneficial for those that do hear this from their oncologist?
I think it's beneficial in many different ways. Let's go back to the patient's perspective. I fully understand the fear factor. A lot of individuals want to put their head in the sand. I get it. They want to run away after doing all the treatments. That's a big mistake, because there's so many things that your oncologist, your functional integrative doctor, your health coach, your nutritionist can do to help you. Because the reality is this, Peyton, that when you don't test, you just guess. And when you guess, you're going to make a mistake. And quite frankly, a lot of times patients aren't motivated till they think something's going on. So these tests, even though they're microscopic, they can tell you to become more vigilant. Maybe you need to be more concerned about certain detoxification protocols, or how do I build my immune system up? It could be a trigger to say, wait a minute here, I do need to do some maintenance IVs, whether those are nutritional, whether your oncologist wants you to do another round of chemotherapy. That's something you can discuss with your practitioner. And that's why these tests in between scans, you can't overdo the CT scans because of the amount of radiation. You need those when they're appropriate, and your oncologist will let you know that. And that's why I think these tests are powerful. I think it's very appropriate and responsible for patients to be aware of this technology and advancements.
And outside of the ctDNA scan, if a scan doesn't catch everything, are there any other like markers or testing that can help pick up those early warning signs before something shows up on imaging?
Yeah, absolutely. I mean, besides the CTCs and the ctDNA, there are other blood tests as well. At Progressive Medical and other forward-thinking functional integrative doctors, we look at certain oxidative stress markers. And the term oxidative stress is measuring the health of the cell. The human body has over 30 trillion cells. And when you have oxidation, which could lead to inflammation, those are the two areas that could be the beginning stages of cancer cells and also other chronic diseases. So one particular test that we do, it measures the 8-OHDG, which is dehydroxyguanosine, and that has been very well published for oxidative stress. So we measure that in all of our patients, and after certain treatments, we actually do a follow-up test. And then when someone is on a maintenance, it's a simple urine test, by the way. It'll tell us what's going on. We also have other tests that will measure inflammation. We're very into gut health. 70 to 80% of your immune function, depending on what scientist you talk to, looking at the microbiome, believes that that's where your immune system comes from. So if you've got pathogens in your gut or you have leaky gut, there's a very specific marker called zonulin, and that measures the tight junctions of the gut lining. That could be another sign that your immune system's failing. So it's not only looking at the cancer cells, but it's looking at your immune system. You're not going to get that from your traditional oncologist. They're very, very good at diagnosing cancer. They're very, very focused. And we need oncologists. We need forward-thinking oncologists to help our cancer patients navigate this. But they also have to work with other practitioners as well. And gut health is critically important. Inflammation and oxidative stress, these are two areas that we can determine. We can't tell you for sure that you're going to get cancer, but we know that if you've got poor gut health and lots of inflammation and oxidative stress, those are two major signs that your body is susceptible to cancer in the future. We've seen many cases like that. There are some new testing that will actually determine if you've got cancer cells. One of them is called the Gallery test, and the RGCC also has a Oncotrace and Oncotrail. Early diagnosis and early detection are critical. So those tests are also exciting as well that you pick up, because if you're going to get cancer, you'd love to get it and pick it up in stage 1. It's very, very sad, right? When you find out that somebody in their 20s or 30s, all of a sudden they got stage 4 colorectal cancer. So we have to look for proactive diagnostics, not to be an alarmist, but to be proactive rather than reactive.
I definitely think the sooner that you can be proactive on healing and getting the game plan together, the better for your overall results of treatment. It's often harder journey for those stage 3, stage 4. It's not impossible, but it definitely takes more integrative modalities once you reach that versus if you catch it earlier, from what I've seen. So
absolutely, yeah.
Let's retouch on the ctDNA and dive a little bit more about that, because from what I see when I talk to patients, this is kind of like a term I always drop because most don't know about it. It's completely new to them. It's a completely brand new term. Can you break down what does ctDNA stand for and how is it actually measured?
Yeah, so the ctDNA is a liquid biopsy, so it's a blood test. And it's basically measuring the DNA fragments. So each of these cancer cells have an imprint of a very specific DNA. And this is actually measuring what's coming off either a tumor or what's beginning. Let's go back to what a tumor is. A tumor is basically morbid matter of cells that are coagulating, clumping together. That in itself, believe it or not, is the body protecting itself. The concern, and here's what I mean by protecting itself, it's encapsulating, right? The concern with these tumors is that if they begin to have something called angiogenesis, and this angiogenesis are vessels of growth. And this is what we don't want. We don't want that these cancer cells are going to be fed and they're going to metastasize, which means they're going to grow outside and spread. So that's kind of what this test is looking for. It's actually measuring the DNA of that specific cancer if it's beginning to replicate. And it's a fantastic tool, because it's going to give information to your oncologist or other practitioner on some proactive steps rather than waiting. In the past, we'd have to wait for scans. All those scans are fantastic. I'm going to call this more precision.
Yeah, I definitely think it is more on the precision side of things. And again, this is not something that someone's oncologist we'll be able to do for them, correct?
I think a lot of oncologists are starting to use this, as a
Oh,
matter of fact. So they're being more educated on it, and I've seen some colleagues that are very open to it. And there's been some criticism about it, but the truth of the matter is that the studies are coming out, and more oncologists are open to it.
well, that's actually good to hear. I wasn't aware that, oncologists are now taking this on through their standard practice. I would assume if the patient is to ask. So those that are listening, I hope this is a new conversation you get to have with your practitioner, and hopefully open that door for you. If not, we can always get you connected with Dr. Agolli and his team or another clinic as well.
Hey, I'm so glad you mentioned that because you're 100% right. The patient is asking for this. I do believe oncologists are more open to it, but you're right. They're not readily offering it. So, yes, for those patients out there, and I know it's hard to believe, but you almost have to help educate your oncologist, okay? You got to remember, oncologists spent many years in fellowship and residency, 4 or 5 years, and they're very, very good at diagnosing. They're very good at fighting the cancer. And sometimes they're just so protocol driven, and you're trying to break away from that dogma. We've been so indoctrinated by protocols, pharmaceuticals, research studies, and all of this. And the reality is, a lot of patients have really good information. They may be lacking the medical knowledge, but they're very in tune with their body and they know what they want. And they're coming in with all this research, and we as practitioners have to be open-minded to listen to them. And surprisingly, we can learn so much. But yes, I tell the patients to educate your oncologist for them to order it, because there are some advantages sometimes ordering through an oncologist rather than an integrative practitioner as well. Sometimes the insurance may cover it. I do know that some of these ctDNA testing and CTC can be covered by certain policies. Always check with your insurance company as well. That shouldn't be the only decision-making process to get that test done. But sometimes when finances are limited, you got to pick and choose wisely. I believe it's that important of a test that should be monitored quarterly, depending on your disease state, that you should be talking to your oncologist about it.
And this is something that can be actively done in between scans. I have patients, as you mentioned earlier, that they're hesitant to continue to get those follow-up scans as frequently as being recommended. They just don't want to be exposed to that radiation constantly. Do you think this is a good enough tool to help them in between scans, say if they want to delay every 6 months versus that 3 months, to assist them in monitoring the levels of the cancer while they're actively undergoing treatment?
Yeah, I think it's a great tool to either delay your scans, exactly like you said, Peyton. There's a lot of radiation. And once again, do the scan when it's absolutely necessary. Discuss this with your oncologist or your other practitioner. The problem is that there's so much radiation and your body has been under so much assault that there are appropriate ways to prepare for a scan. There's certain nutrients that you should be doing for the scan. I'm a big believer in oxygen therapy. We use ozone, we use infrared technologies, red light, and there's all kinds of things to help prepare your cells for the onslaught of radiation. But if you can delay it 3, 6, even 9 months, depending on your disease state, with this blood testing, okay, I do believe you need to do an eventual scan, okay, whether that's yearly or whatever, every 6 months with your oncologist. This is going to be a tool that could assist patients in monitoring the disease state.
And since you kind of touched on things that could be beneficial for people to prepare for a scanner, are there any supplements you should absolutely do before your scans, or is it by patient, by diagnosis?
There's certain things you can do. Good nutrition is very, very important, of course. And there are certain nutrients that I think are game changers. Proper minerals. Okay, I think magnesium is responsible for over 300 enzymatic processes. Indirectly, that can protect you from radiation. But there's certain key antioxidants that have been researched, like polyphenols, of course, in green tea. I think a lot of research on resveratrol, psilocybin, that also can protect the cell. That also, in some research studies, can be also anti-tumor as well, depending on what's going on. If you want to just keep it so simple, I would increase your probiotics, and I would also look at the curcumin you're taking. The curcumin has been one of the most researched compounds when it comes to cancer and inflammation. So something as simple as that. Another strategy, Dr. Walter Longo published studies on fasting before you do chemotherapy up to 72 hours prior. Also, the same principle can apply when you're doing a scan. I know that sounds counterintuitive, but when you fast, right, your body goes into that protective mode. It's going to protect the cells. The cells become more resilient and you can get rid of these dead cells. We call this autophagy. So a couple of different strategies like that. Certain scans can save your life, but use them wisely, because overscanning can actually affect the cell and cause DNA damage and have your cells in a place where you could have cancer in the future. Coagulation is a big part of cancer. So I always give this example. I want you to visualize, Peyton, have you ever been to an area where there's a lot of swamps like South Florida and the water is very murky? Okay, so I want you to visualize that this is what a cancerous patient's blood looks like, okay? And then I want you to now visualize the Colorado Rockies, the river. What's it look like flowing?
Right. Clear. Beautiful.
Very pristine and clear. So this blood is the river of life, right? So you want to have it very clear, and that's why exercising, looking at certain strategies to naturally thin the blood. It's a very delicate pathway of thinning your blood and coagulation, okay? This is when you need to go to an expert to find out what's contraindicated.
And are there any like limitations or risks that someone might come across or need to be aware of before asking for the ctDNA test?
I don't think there's any particular risk whatsoever. There is no contraindication when it comes to the medication. There is a timing issue with the chemo, of course. And so that's something that these laboratories have been studying about. But I know when it comes to looking at the RGCC test, you have to be off certain medications and supplements and therapies for 14 to 21 days prior. Otherwise, it's not going to be as accurate. When it comes to the other tests from the Signatera, I do not believe that's the case. But pretty much rule of thumb, we like to wait 14 to 21 days post-treatment. So if you just stopped your chemo, I don't recommend you do that right away. You should wait, listen to your practitioner. It's probably going to be about 90 days before you can do that.
I didn't know actually that can interact with the ctDNA. It makes sense though.
Yes,
can throw
absolutely.
these numbers off. Is there a particular patient story that sticks into your mind of when they used the ctDNA and how it gave you like a clearer picture or them and changed the direction of their treatment journey?
I will say many patients that come into our clinic report back to us how they feel relieved by having a tool. It gives them peace of mind that they know that every quarter that they're going to be able to know what's going on with their cancer. There was one patient in particular that Dr. Bouquet and Magda, our nurse practitioner, has been following for the past 2 years. And he was doing great, but then his test came back really, really, really high with the Signatera. And that prompted both of them to do further testing and back into treatment again. He went to his oncologist and found out the cancer began to grow. And that gave him a reason to go back into treatment because, there's also treatment exhaustion for a lot of these patients, that they're doing so many different treatments fighting for their life that finally when they can have a pause and live their normal life again, this allows them to do that. Because we've seen patients that are supposedly in remission and then 3 years later, something, and I'm not here to scare anybody. I'm just telling you the facts.
No,
It comes back and they're like, how did this happen to me again? And they did no maintenance therapies, no testing in between. And that was the unfortunate circumstances.
I hear that too commonly, actually. And I hear people that say they were told 3 months ago that there were no evidence of disease, and then they find out about the ctDNA and it's saying otherwise, And thankfully, those years didn't pass, right, to where they would end up in a worse situation.
Absolutely agree with you. And, I want to go back again. This is not just a cliche saying, if you don't test, you just guess. A lot of these laboratories, they're CLIA certified laboratories. CLIA is an organization that was started in the 1980s to approve laboratories for doing testing. And there's a flexibility there to do laboratory developed testing. It's called LDTs for research. So a lot of these tests are not FDA approved. Everybody thinks, well, it's got to be FDA approved, but no, these laboratories have a CLIA license and they're doing research and it's laboratory developed. And it allows them to develop innovative testing such as this. It's very exciting. Otherwise, if you got to wait for the FDA, you're talking 7-10 years.
Yeah.
And we're going to miss all these advancements. It allows your practitioner the tools to have a conversation with you on what to do next. It gives you the power as a patient to be proactive rather than reactive, because it's important to do that.
And I feel like it helps people too. Say in some cases it might be necessary for someone to continue to do that chemo session or the immunotherapy session or the hormonal blocker for a small portion of time versus just completely ending treatment now that their scan is showing to be clear. I feel like this might give a better understanding for people to accept certain ways those treatments that are being proposed to them versus saying, I'm not going to do anything at all. So,
Yeah, great point. And I'm going to say this much. I'm kind of to the extreme because I've been doing this a long time. I don't think that you should ever stop doing certain treatments and therapies, even if it's a maintenance. Now, it doesn't mean you need to do chemo. There's a time and place for do chemo. But in between chemo, you should be focusing on your lifestyle, your wellness. You should be becoming more resilient. You should learn techniques that are research-based. You should educate yourself on proper hydration, proper detoxification, rebuilding your immune system, how to do this type of fasting that has been researched properly. You should always be doing something. If you're a cancer survivor, I applaud you. But cancer is just around the corner and you need to be resilient as much as possible. Use this technology to your advantage. And that's my message for your viewers and listeners today.
We can go ahead and jump into RGCC test, or also known as the Greek test. Let's talk about what it actually does and how it is different from the ctDNA.
The RGCC has multiple different tests. One of the tests that we like to use when a patient has a diagnosis of cancer, our practitioners have been trained and they like to use the Onconomics Plus, which is it's a blood test. There are some restrictions. You can't be on certain medications and treatments for 14 days, some 21 days. So some patients, that can concern them because they want to get into treatment right away. The test that we like using the most for our cancer patient is the Onconomics Plus, and that's taking your blood, it's a liquid biopsy, and it's going to tell you which medications, chemo included, and other immunotherapy are most sensitive for your cancer cells. It'll tell you repurposed medications as well. It'll also tell you which herbs or nutrients will assist on stopping the replication of these circulating tumor cells. And that is going to help your body either fight the cancer completely or delay the cancer's ability to replicate and metastasize. So it's basically giving your practitioner and you the tools on what your protocols can be. Because what we've learned, Peyton, over the years, and Dr. Mitchell, again, is one of the educators talking about repurposed medications and integrative oncology, is when you're putting together a treatment protocol, you just can't do the same thing over and over again. You just can't keep on doing chemo, keep on doing high-dose vitamin C. You have to confuse and go about it from different angles and capacities. And that's kind of what we learned over the past 5 years. And that's why this test is so powerful when it's used properly. We do all of that testing for every single patient that walks in our door. That is our philosophy, that we want to at least attempt at why did you have cancer in the first place. Now, we may not know 100% of the time, but we'll have a pretty good idea. And I call this the 4 I's of chronic disease and cancer. I, number one, test for infections. I, number two, metabolic, insulin resistance. Insulin is such an important hormone that regulates glucose metabolism, but at the same time, if you have insulin resistance, you have glucose outside the cell. That could be contributing to your cancer. I, number three, inflammation. Inflammation could be from infections, from insulin resistance, foods. It could be from chemicals, toxicity. Inflammation affects how the body heals and responds. And the last I is your immune system. Your immune system has failed you if you had a cancer, if you're diagnosed with cancer. One of the greatest discoveries right now in conventional oncology is immunotherapy. Yeah, there could be side effects, but immunotherapy has so much promise on how we look now on treating cancer.
Whenever I mention to some clinics about the RGCC, there's a lot of skepticism of using it. Some practitioners don't even know how to read it. Can you explain how someone can go about doing that? And like how they locate the right practitioner for them to interpret those results?
Yeah, great question. Let me tell you, it's a very difficult test to interpret. You have to take the course. I always tell practitioners, if you're going to order a test, you better learn how to interpret it, okay? Because it's so important to interpret this test. And it does take time to study. Typically, an oncologist is going to look at your cancer. They're going to diagnose you based on the stage, and they're going to give you a protocol. And now you can follow that protocol to the T. And my question would be, well, depending on where you're at and what type of cancer you have, it may work, but the side effects are just tremendous. And that's been the same type of treatment modality, that reductionist thinking, for the past 40 plus years. And we've been battling cancer in our country for a long time. And, cancer's all-time high. Over 2 million Americans were diagnosed with cancer last year. We're seeing more and more cancer today. And it's a tragedy, of course, but I think it's because we have not been forward thinking. Now, I do think that the immunotherapies are really promising for conventional oncology, but really it's those patients that know that they need to have a strong immune system, better detoxification, better stress reduction, and those that are practicing functional, integrative, holistic, and thinking outside the box, they usually do better. Okay, so that's why I like the RGCC. If your goal is to be precision, I think that's where you should take a seriously hard look at it. And it's going to give you the actual individualized treatment. Some of these IV therapies and some of these treatments could be very, very costly. So wouldn't you want to know exactly what to do? For example, we offer curcumin. Curcumin is a phenomenal IV, but it can also be very expensive. Wouldn't you want to know if it's going to work for you? So that's one of the reasons why I like it, Peyton, for the patients that can afford to go through the program and get the testing done. It just makes a lot of sense. But absolutely, you don't need to have this test to fight cancer. It's just another great tool to help you and your practitioner. Now, when it comes to finding the right practitioner, I only recommend that you go to the RGCC website and find a practitioner that's gone through the training. It's a lot of studying. It's a lot of collaborating. You just can't pick it up. It literally takes about an hour and a half to 2 hours to interpret those results.
And for the results of the RGCC, what people are to expect whenever they do get these results back for their testing, maybe give some more examples of what they would see on their both alternative and maybe conventional treatments.
Yeah, well, for example, it's going to tell you if ivermectin's working, mebendazole. It's going to tell you all the different supplements. It'll tell you the chemotherapy sensitivity. So those are great examples. And, I'll give you one example. Patient came in and they were a big believer in functional integrative medicine, and they were doing high dose vitamin C, which I'm a big believer high dose vitamin C. even though a lot of oncologists said never do vitamin C. Well, oncologists say never do vitamin C because it's an antioxidant.
Mm.
Anything over 25 grams is a pro-oxidant. As a matter of fact, University of Iowa did a study with pancreatic cancer, and basically the patients that did high-dose vitamin C in between the chemotherapies, and you have to look at the half-life of the chemo. So you don't do vitamin C the same day as the chemo. You wait 48 to 72 hours pre or post, sometimes 24, but more or less 48 hours. And that study actually clearly indicated not only was it safe to do it, but the outcome was better. They had 19 months more survival rate,
Wow.
which is amazing for pancreatic cancer. So I had a patient come in, and I believe they met with Dr. Bouquet, and they wanted to continue their vitamin C. Dr. Bouquet talked them into the benefits of doing the RGCC, and guess what it found? That the vitamin C was not effective for them. I believe poly-MVA was effective for them. So once again, the vitamin C hurt them? No, but we found out that poly-MVA and curcumin and resveratrol had a higher percentage of stopping these circulating tumor cells, which is really the ultimate goal, and causing that apoptosis at the cellular level. And that's what I like about the test.
Wow, that's amazing. People hear of, vitamin C that primarily to do that, but it's so expensive, So if someone's not as sensitive to that as they would be something else, it's definitely best to get this individualized testing. Because the main thing I always hear is financing issues, being able to afford, the alternative treatment.
There's no doubt, because cancer is expensive, whether you're doing traditional medicine or not. And you want to be wise, you want to be a good steward, you want to go to practitioners that can set you up with a protocol that's not the same. You have to confuse the body. If you and I were just working out with weights and all I did was dumbbells every single day, well, my muscle is going to atrophy. I need to confuse my body. And the same principle, especially when we're teaching metabolic flexibility, you want to offer other treatments in synergy to bring that body into homeostasis. And this is one of those tools that will help, because ultimately that's what it's all about. You're an individual. You should be treated as an individual.
Yeah, and it sounds like, RGCC could potentially be one of these major pieces of the puzzle. So outside of these, as you mentioned earlier, with the deeper layers of things like mold exposure, viral load, inflammation, gut health, and why they are important for patients. And what are some common tests patients can use to get this information? I understand that these type of testing are not offered usually through standard oncology.
Yeah, great question. I think a stool test is so important. Not just a regular stool test from Quest or LabCorp. They're not going to pick up on the microbiome. We like to use a laboratory called Doctor's Data, Diagnostic Solutions, because they do a sensitivity. So if a pathogen pops up, if you have a very specific fungus candida, they will actually give you a sensitivity if nystatin, diflucan, ketoconazole, grapefruit seed extract, silver, oregano, berberine, if any of those actually work, okay? So rather than just guessing, you can literally make them. We make herbal tinctures, and we actually have botanical tinctures that are very powerful, and we do prescribe medication. You want to wipe that out and get rid of that infection, because when you're getting rid of that infection, your immune system is not under attack, and your immune system becomes stronger, and your immune system can do its job against these cancer cells. Because ultimately, what do we want? We want apoptosis, which is normal cellular death. I also want to mention environmental toxicants. I do believe that heavy metals are deleterious. That's a medical term that we use, which means harmful, slowly pertaining to health.
Mm-hmm.
So you can come across certain foods that may have some heavy metals. You have it a couple days, no big deal. But if you have it all the time, it builds up. And let's just say that you're a slow detoxifier, or you've got chronic constipation, or you're a non-sweater. You don't release toxins. Well, that makes you more susceptible to cancer as well. So we do also do the heavy metal testing with the provocation. We're looking at inflammation from foods. I mean, you can have the healthiest diet in the world, but if 2 or 3 foods are causing inflammation, it's going to affect your immune system. And that's important. Lyme disease, we call it the great imposter, right? Lyme disease can also affect, and we look at co-infections. So if you're only seeing a conventional oncologist, I'm going to encourage your viewers to seek a qualified functional integrative practitioner to assist you on the right type of testing that you need. Work with Heal Navigator, they can find you somebody, because it's more than just doing conventional or even integrative treatments for cancer. You have to find out why. And hopefully, if you can find out why, you can address those root causes. So when you get into remission, you'll have a better outcome.
Yeah, this is something I'm very passionate about. I knew that you would be the perfect person to speak about all these different testing. I mean, I know for those that are listening, and they're probably thinking to themselves, oh my gosh, this is a lot of information. How do I even begin? Like, how do I start turning all this information into an actionable plan? So what is your advice to them?
I say go through Heal Navigator. You guys done a great job researching. Listen, you do with what you can with what you have. Here's my message. If you have cancer, you have a battle.
Right.
And when you have a battle, you want to get the best team. This is a team approach. I always say this to a lot of our colleagues and patients, that wellness is we, it's a team. Illness is I, it's individual.
Right.
If you just stay by yourself, you're going to continue to get sick. You need a team approach. You need an integrative doctor. You need a integrative practitioner. You need a health coach. You need a trainer. You need it all. But pick and choose wisely. And unfortunately, a lot of things that I'm talking about, it definitely takes an investment. And you notice I use the word expense. This is an investment.
Right.
And there's a big difference between ability to pay and willingness to pay. If you're only looking for your insurance to pay, well, let's start off with the insurance right now. Insurance is actually designed to defray catastrophic cost, okay? So that's emergencies, accidents, chemotherapy is one of those areas. But look how high our deductibles are now. We're seeing deductibles $3,500, $5,000, $7,500, $10,000. You can invest that money, a fraction of it,
Right.
and go with a functional doctor and spend a portion of that to do some of these testing and do some of these treatments. The knowledge is powerful. I don't know if you've got a fungus. I don't know if you've got lead or mercury toxicity. If you do, you need to get a plan of action to remove those safely, okay? And that's with an experienced integrative practitioner. Don't go online and start detoxifying yourself. You can cause more damage,
Right.
especially when it comes to heavy metals, okay? You can become very sick not doing it properly. So make an investment. Look at your budget. Make a decision and stick with that. I did a little bit of research on this, and this is interesting, that when you're not battling cancer, whether you're doing wellness and prevention, 10% of your income should go towards staying healthy. Now, what does that mean? If you make $50,000 a year, you should be spending $5,000 a year, okay? Some people say, oh my gosh, I can't spend $5,000 a year. Well, listen, you're going to movies, you're going out, you're spending your money on different things. You have to invest in your health. Your health is wealth. Now, when you're sick with a chronic disease or something as serious as cancer, 30% of your income should be devoted to beating your disease, because your disease affects your whole life. And you got to make some radical shifts in your life.
I will say, out of all the facilities I've never met, I don't want to compare, but the team that you guys have is phenomenal. I've had so many patients that come to us with budget. That's the main concern. And your financing team, your patient coordinators, the empathy you have to find a solution to meet them where they're at financially, to make something work for them, whether it's just getting testing done so they can do something in the long run through remote care, whatever the case may be, showing up for one day versus maybe 1 week, or, showing up for a 2-week protocol versus, a 2-month protocol. You really do try hard to support people where they're at financially. And I want to applaud you for doing that.
I appreciate that, Peyton, because listen, at the end of the day, we're here to help people as much as possible. And I know that it's very difficult and challenging. Unfortunately, a lot of this testing and treatments and therapy could be very, very overwhelming and very expensive. And I wish that we'd had other answers. But listen, don't ever lose hope. You could literally be at death's door. If you can just get a little momentum and moving in the right direction, the body's an amazing healing tool. So my message is a message of hope. Don't give up. Get a team. And I've got to say that attitude, right? One of the most important things, okay? And it's tough that when you're sitting there and you got a bad test result or a bad scan, but if you can show that resilience, I've seen more patients with resilience, even if their test results are not great, that they overcome. And it's also not only about beating cancer, Peyton, it's about quality of life and spending the time that you have with your family and your loved ones and doing what you can. And that to me is the most important thing as we go through this journey. And we're constantly looking for innovative ways to help our patients live a long, healthy life. And that is our focus at Progressive Medical.
Well, thank you so much, Dr. Agolli, for sharing your insight and experience so openly today. For those that are listening, if today's conversation gave you clarity or sparked new questions, we'd love to help you take the next step. You can visit healnavigator.com. We'll put the link in the description below, where we can help you explore alternative options, or you can connect with one of our advisors who can guide you through some of those choices. If you know someone who could benefit from hearing this, please like, share, and subscribe so more patients can access this information. Until next time, take care and be well.